Hello viewers, my name is Dr. Rajiv. Welcome to my education channel, YouTube Surgery and Orthopedic Education. Today's topic of discussion is stem cell therapy in tissue engineering and regenerative medicine. In the end, please subscribe to our channel and give us a like if you find the discussion useful. Also, don't forget to press the bell icon below to get my videos regularly. Tissue engineering is a discipline that uses a combination of cells, scaffolds, various growth factors, and chemotactic factors to make functional constructs to restore, maintain, or improve damaged tissues or whole organs. The cells used in tissue engineering can be both differentiated cells or somatic cells and stem cells according to their differentiation potential. They can be obtained from autologous or allogenic sources. The best source of cells for tissue engineering depends on the specific application. While embryonic stem cells, ESCs, and induced pluripotent stem cells, iPSCs, have shown great potential in tissue engineering, but adult stem cells, ASCs, and mesenchymal stem cells, MSCs, have advantages in terms of availability and ease of isolation. The choice of cell source is important for the success of clinical applications. For example, embryonic stem cells have the potential to differentiate into any cell type and can be used for a wide range of applications, but their use is limited due to ethical reasons. Adult stem cells are easy to isolate and do not raise ethical concerns, but their differentiation and proliferation potentials are limited. Induced pluripotent stem cells have similar properties to embryonic stem cells and do not raise ethical concerns, but their use is limited due to the risk of tumor formation. Fully differentiated somatic cells used for tissue engineering and regenerative therapy are obtained from normal tissues, such as epithelial cells of skin, chondrocytes of cartilage, uroepithelial cells of bladder wall, etc. Such tissues can be obtained by tissue biopsy, known as autologous cells, or from deceased unrelated donors, known as allogenic cells. Using retroviral or lentiviral transfection technique, the somatic cells may be converted into stem-like cells. This technique of nuclear reprogramming, also called transdifferentiation, allows for the reprogramming of one somatic cell type directly into another. Therefore, it can be used to develop novel tissue engineering applications to treat diseases and injuries. The major advantage of the autologous source is that after implantation they are not rejected by the recipient's immune system and hence there is no requirement for immunosuppression. The major disadvantage is that somatic cells are not readily available in sufficient numbers and they have only limited proliferative potential in vitro, which means their numbers cannot be readily expanded to meet demands. These limitations are overcome by using stem cells. Stem cells are undifferentiated or non-specialized cells that have the ability of self-renewal. They can divide and create an identical copy of themselves and can also divide to form cells that mature into specialized cells of every type of tissue and organ in the body. Stem cells are capable of unlimited self-replication via asymmetric cell division, a process known as self-renewal. Stem cells originate from two main sources: adult body tissues and embryos. Scientists are also working on ways to develop stem cells from other cells using genetic reprogramming techniques, also called transdifferentiation technique, as stated previously. Stem cells can be grown in culture and can be induced to differentiate into a particular cell type either in vitro or in vivo. Because of their unique ability of self-renewal and transdifferentiation into any specialized cell type, they have enormous potential for use in tissue engineering and cell-based regenerative therapy. There are several different types of stem cells for use in regenerative medicine. These may be derived from early embryo, known as embryonic stem cells, fetal tissue, known as fetal stem cells, normal adult tissues, known as adult or somatic stem cells, or from reprogramming of adult cells, known as induced pluripotent stem cells or iPSCs. Based on differentiation potential, stem cells may be multipotent or totipotent or pluripotent. Somatic stem cells are also known as adult tissue-resident stem cells or simply adult stem cells. They are found in grown-up organs or tissues. They can self-renew and produce differentiated cell types similar to that same organ or tissue. They replace senescent cells and repair injured cells in normal adult life. Adult stem cells are typically described as unipotent, oligopotent, or multipotent cells that continue to exist into the postnatal period. Their persistence into adulthood offers them great potential for clinical use. The best examples of somatic stem cells are hematopoietic stem cells, mesenchymal stem cells or stromal cells, endothelial progenitor cells, and neural stem cells. The hematopoietic stem cells are widely used for treatment of hematological malignancies. The most widely used somatic stem cell type for tissue engineering and regenerative therapy is the mesenchymal stem cell. Because the isolation of adult stem cells does not result in loss of any life, research involving adult stem cells does not raise any ethical concerns. Mesenchymal stem cells are multipotent stromal cells. They are the most studied stem cells. Morphologically, they resemble fibroblasts. Their cell body contains a large round nucleus and a prominent nucleolus. Mesenchymal stem cells were first identified by Friedstein in 1970 in guinea pig bone marrow and spleen. Mesenchymal stem cells possess the greatest potential for tissue culture and regenerative medicine applications. These can be obtained from a variety of tissues, including bone marrow, adipose tissue, hair follicle, periodontal ligament, dermal tissue, intervertebral disc, amniotic fluid, cord blood, placenta, and umbilical cord. The developing mandibular third molar tooth is a rich source of mesenchymal stem cells. Less invasive and high-yielding methods of procuring mesenchymal stem cells are crest aspiration of bone marrow and liposuction of fat tissue. Once isolated, they can then be used either immediately or after expansion by in vitro culture. They can be differentiated into the desired lineage in vitro by addition of suitable growth factors and chemicals. Mesenchymal stem cells have the ability to differentiate into a variety of specialized cell types of the mesodermal, ectodermal, and endodermal lineages, including osteoblasts, chondrocytes, adipocytes, tenocytes, myocytes, hepatocytes, and neurons. As per the minimum criteria laid down by the International Society for Cell Therapy, the mesenchymal stem cells must adhere to plastic under standard culture conditions, must express the cell surface markers CD73, CD90, and CD105, must lack the expression of hematopoietic stem cell surface markers such as CD34 and CD45, and must have the capacity to differentiate into osteoblasts, adipocytes, and chondrocytes in vitro. Mesenchymal stem cells possess potent trophic, anti-inflammatory, and immunomodulatory properties due to their ability to produce growth factors such as vascular endothelial growth factor VEGF, insulin-like growth factor IGF, hepatocyte growth factor HGF, and prostaglandin E2. Because of relative ease of procurement and due to their abilities of multilineage differentiation and immunomodulation, the autologous mesenchymal stem cells have been used clinically in a variety of clinical applications such as treatment of burns, repair of defects in cartilage and bone, neuronal regeneration, heart regeneration, and treatment of graft versus host disease (GVH). Embryonic stem cells are derived from the inner cell mass of 5-day-old blastocyst. These are pluripotent stem cells, means these cells can develop into any type of cell and tissue in the body. These cells can potentially regenerate all the cells and tissues lost because of any injury or disease. Embryonic stem cells have much greater proliferative ability than mesenchymal stem cells and can differentiate into all types of specialized cells. But the major limitation with their use is ethical, because they are derived from a live embryo and these need to be destroyed to obtain embryonic stem cells. The technique for isolating and growing human embryonic stem cells in culture was developed by James Thomson in 1998. Human embryonic stem cells are obtained from surplus embryos during the process of in vitro fertilization for treatment of infertility. Cells from embryonic stem cells are normally allogenic and therefore are liable to immunological rejection. Research is going on to produce embryonic stem cells that are autologous by the process of somatic cell nuclear transfer (SCNT). In this method, the nucleus from a somatic cell of the intended recipient is transferred into an oocyte that has had its nucleus removed. Stem cells obtained from the blood, bone marrow, and other tissues of aborted fetuses are known as fetal stem cells. They are pluripotent. The main problem associated with the isolation of fetal stem cells is that they can be obtained only from 8 to 9-week-old fetuses. Hence, they also pose ethical challenges but less than embryonic stem cells. They can divide, proliferate, and provide progenitor cells which can differentiate into specialized cells in vitro as efficiently as embryonic stem cells. Fetal stem cells stand somewhere between embryonic stem cells and adult stem cells. Fetal stem cells are of two broad types: pluripotent stem cells and hematopoietic stem cells. Pluripotent stem cells can differentiate to form the inner cell lining of the gastrointestinal tract, muscles, bones, urogenital organs, organs of the nervous system, and the epidermis. Hematopoietic stem cells differentiate and specialize to become various types of blood cells. Fetal stem cells have been used in regenerative therapy in a variety of diseases, including Parkinson's disease, diabetes, and spinal cord injury. But the extent of their clinical benefits is debated. Induced pluripotent stem cells are a type of artificially created pluripotent stem cell that can be generated directly from a somatic cell, such as skin fibroblasts or peripheral blood mononuclear cells. This technique was discovered in 2006 by Shinya Yamanaka and Kazutoshi Takahashi in Japan. In this technique, certain pluripotency or reprogramming factors such as OCT3, OCT4, SOX2, Kruppel-like factor, C-mice, NANOG, and Lin28 are introduced into non-pluripotent cells using retroviral or lentiviral vectors. These induced pluripotent stem cells are then expanded and treated with specific differentiation factors which induce differentiation into the desired specialized cell types for use as treatment. The above technique of nuclear reprogramming, also called transdifferentiation, causes reprogramming of one somatic cell type directly into another. Because retroviruses integrate themselves into the recipient's nuclear genome, their use carries the risk of virus-induced tumor formation. To reduce the risk of tumorigenesis, non-retroviral vectors such as adenovirus and Sendai virus vectors, episomal vectors, and synthetic RNA have been used because these do not insert their own genetic material into the host cell genome. The whole process of obtaining an adequate number of induced pluripotent stem cells takes several weeks. Induced pluripotent stem cells have differentiation potential similar to embryonic stem cells. Because they can be derived from the patient's own or autologous cells, there are no ethical concerns and very less risk of immunological rejection. But there is a high risk of genetic and epigenetic abnormalities in recipients. A great advantage of using patient-specific induced pluripotent stem cells is that these perfectly match the cells and tissues of the recipient because these are obtained from patient's own adult cells. This could help overcome the risk of immune rejection, which is a major challenge in regenerative medicine.